Hello, everybody. You are on the Dr. Y channel, and I am Dr. Armen, Professor Armen Astvatsatryan from Yerevan, Armenia, and we continue to answer your questions of the Greek exams. So take your pens, papers for making the notes. It's very important to do that. And let's go. Yeah, open the questions, yeah. All questions, actually two questions I see, yeah. It's about pneumonia. Okay, so my friends, if you got question in your exam tickets about pneumonia, what's pneumonia? You answer like this. So what is pneumonia? Pneumonia is acute inflammation of the lungs caused by infection. This is infection disease. Initial diagnosis is usually based on a chest x-ray and clinical findings. Causes, symptoms, treatment, preventive measures, and prognosis differ depending on whether the infection is bacterial, mycobacterial, viral, fungal, or parasitic. Whether it is acquired in the community or hospital, whether it occurs in a patient treated with mechanical ventilation, and whether it develops in a patient who is incompetent or immunocompromised. Immunocompetent or immunocompromised. For me, it's largely sufficient. But who knows, my friends? Who else will be on the exams? Who else can you ask the questions? Because I see continuing of the question. Yeah. Let's see, huh? So no classic scheme of the questions. Etiology, pathogenesis means pathophysiology, huh? Etiology, pathophysiology, pathogenesis, and classification. Okay, let's go. About etiology, pneumonia, once again, can be caused by a variety of microorganisms, including bacteria, if you can remember, such as Streptococcus pneumonia, Haemophilus influenza, and Legionella pneumophila, viruses such as influenza virus and respiratory syncytial virus or syncytial virus, syncytial virus, fungi such as Candida and Aspergillus, and pathogens such as, for example, Mycoplasma and Chlamydia. Pathogenesis. The pathogenesis of pneumonia involves the invasion of microorganisms into the lung tissue, resulting in inflammation and the accumulation of fluid and cellular debris in the airspace. This can impair the function of the lung. Function means working, leading to symptoms such as cough, fever, chest pain, and difficulty breathing. Classification. Pneumonia can be classified based on several factors, including the type of microorganism causing the infection, the location of the infection with the lung, such as lobular pneumonia or bronchopneumonia, and the presence of risk factors or underlying conditions, such as, for example, community-acquired pneumonia or hospital-acquired pneumonia. Pneumonia can also be classified based on the severity of infection using most useful tools such as CURB-65 and PCI scoring system. So, of course, you have to open the abbreviation. What is CURB-65 or PCI scoring systems? If professor insists on the questions. So, CURB-65 and PCI are two commonly used scoring systems to assess the severity of pneumonia that we've got. Not we, the patient, of course. Okay, so CURB-65. The scoring system uses 5 clinical criteria to assess the severity of pneumonia, and predict the risk of mortality. The criteria include confusion, urea, respiratory rate, blood pressure, and age 65 or older. Each criterion is assigned of a score 0 to 1, with a maximum score 5. Patients with score 0 or 1 are considered with low risk, and logically, obviously, while those with a score 2 or plus considered high risk. PCI, Pneumonia Severity Index. Okay? PCI scoring system uses several patient characteristics and clinical findings to predict the risk of mortality and the need for hospitalization. The criteria include age, coexisting illnesses, vital signs, laboratory findings, and radiographic findings. Each criterion is assigned a point value, and the total score is used to stratify patients into one of 5 risk categories, ranging from low to high risks. Both CURB-65 and PCI scoring systems are widely used in clinical practice to help guide the management of pneumonia, including decisions regarding hospitalization, antibiotic therapy, and the need for more intensive care. Types of pneumonia depending on etiology and duration of occurrence. Duration of occurrence. Okay, so no one will understand. So pneumonia can be classified based on the etiology, the cause of the infection, and the duration of occurrence. No, we above mentioned that, but once again, let's repeat. So etiological classification. Bacteria pneumonia caused by bacteria such as Streptococcus pneumonia, Haemophilus influenza, Legionella pneumophila, and others. Viral pneumonia caused by viruses such as influenza virus, respiratory syncytial virus, and syncytial virus, RSV, respiratory syncytial virus, and others. Fungal pneumonia caused by fungi such as, or fungi, fungal pneumonia, fungi, fungus. No, I understand fungus, such as Pneumocystis jirovecii, Candida species, and Aspergillus species. Mixed pneumonia caused by a combination of microorganisms such as bacterial and viral infection. Duration of occurrence classification. So acute, understand, acute, subacute, and chronic pneumonia. So this is a question of time. Acute pneumonia develops suddenly and lasts for a short period. Typically, this is a question of a few days to maximum a week. Subacute pneumonia develops gradually and lasts longer than acute pneumonia, usually 2 to 4 weeks, 1 month. And finally, chronic pneumonia. Chronic pneumonia also lasts longer than 4 weeks and may be caused by a variety of factors such as persistent infection, exposure to irritants or chemicals, or underlying lung disease. These classifications are mutually exclusive, and pneumonia can be classified based on both etiology and duration of occurrence. For example, bacterial pneumonia can be either acute or chronic, while viral pneumonia is acute in nature. Not usually acute in nature. What? Clinic of community acquired pneumonia, hospital acquired pneumonia, aspiration pneumonia on the background immunodeficiency. What? No, means, okay, I understand. So when you read clinic, you understand the clinical signs and symptoms. So they want to ask you signs and symptoms of community-acquired pneumonia, hospital-acquired pneumonia, and aspiration pneumonia in immunocompromised patients. Immunodeficiency, immunocompromised patients. So immunocompromised patients may present with atypical signs because they are immunocompromised, and symptoms of immunocompromised patients may present with not classical, so atypical signs and symptoms of pneumonia, which may vary depending depending on underlying cause and severity of immunodeficiency. However, some most common signs and symptoms of community-acquired pneumonia, hospital-acquired pneumonia, and aspiration pneumonia in immunocompromised patients may include. Actually, when we talk about commonly community-acquired pneumonia, it's a classic pneumonia. So they are community-acquired pneumonia, fever, chills, cough, with or without sputum production, shortness of breath, dyspnea, chest pain, fatigue, muscle aches, pain, muscle ache, muscle aches, pains, aches. Hospital-acquired pneumonia, fever, new or worsening cough, shortness of breath, chest pain, fatigue. Confusion of changes in mental status, particularly in aged persons, elderly persons. In some cases, respiratory failure or sepsis. Aspiration pneumonia, cough with or without sputum production, chest pain, fever. You get me fever. You give me fever. Chest pain, fever, weakness or fatigue, difficulty swallowing, dysphagia, and abdominal pain or discomfort, particularly in cases of gastric aspiration. It's important to note that immunocompromised patients may not always exhibit these typical signs and symptoms and may present with more subtle or non-specific symptoms. It's therefore important to consider their immunocompromised status and underlying conditions when evaluating for possible pneumonia. Next question, features of the course in adolescence and old age. Clinical features, signs and symptoms, how it's going on. Pneumonia in adolescents and aged persons. So pneumonia in teenagers and teens, in adolescents means teenagers, have some unique features compared to the other age groups. So, okay, here are some key features of pneumonia in adolescents. Risk factors. Adolescents with underlying health conditions such as chronic lung disease or immune deficiencies, of course, are at higher risk of developing pneumonia. Additionally, lifestyle factors such as, unfortunately, smoking. It's a very common problem in young persons, such as smoking or substance, not smoking just, substance abuse may also, no drugs, may also increase the risk of pneumonia in this age group. And we see this problem larger and larger and larger now. Very, very common, unfortunately. Very often, yeah. Symptoms and signs, actually. The symptoms of pneumonia in adolescents are similar to those in older age groups and may include cough, fever, chest pain, shortness of breath, fatigue, and weakness. However, adolescents may be more likely to experience chest pain in discomfort than younger children. Actually, it's highly questionable why, but it's like this. Diagnostic challenges. Diagnostic challenges. Adolescents with pneumonia may be more difficult to diagnose, as they may not always present with the typical symptoms or have abnormal physical exam findings. Additionally, they may have a lower incidence of bacterial pneumonia compared to other age groups, and viral pneumonia may be more commonly in this age group. Treatment for pneumonia in adolescents typically involves antibiotics for bacterial infections and supportive care for symptom relief. Adolescents may also benefit from vaccinations against the bacteria that commonly cause pneumonia. No, the most commonly is, of course, Streptococcus pneumonia. It's important for adolescents with suspected pneumonia. It's important, yeah, with suspected pneumonia to receive prompt medical evaluation and treatment, as early intervention can help prevent complications and promote recovery. So pneumonia in aged persons, in elderly. No, when we talk about elderly, we understand 65 plus. So pneumonia in elderly 65 plus can have some unique features compared to other age groups. Here are some key features, my dear friends, of pneumonia in the elderly. Risk factors. Elderly persons with underlying health conditions such as chronic lung disease, heart disease, diabetes, immune deficiencies are at a higher risk of, obviously, of developing pneumonia. Additional factors such as institutionalization, cognitive impairment, and malnutrition can also increase the risk of pneumonia in this age group, 65 plus. Symptoms and signs. These symptoms of pneumonia in elderly can be less specific than in other age groups and may include cough, fever, confusion. No, actually, this is a delirium. Why not in elderly? Weakness, fatigue, and shortness of breath. In some cases, the only presenting symptom may be a decline in overall function or a change in mental status. Diagnostic challenges. Diagnosis of pneumonia in elderly can be challenging, as they may not always present with typical symptoms or have abnormal physical exam findings. Additionally, the presentation of pneumonia may be masked by underlying comorbidities or chronic illnesses. No, of course, aged persons. Complications. Elderly persons with pneumonia are at a higher risk of developing complicating such as respiratory failure, sepsis, and other infections. Additionally, pneumonia can lead to hospitalization and increase the risk of mortality in age group. So you enter to the hospital and you finished. Hospital-acquired pneumonia. Nosocomial diseases. Nosocomial diseases. Hospital diseases. In-hospital diseases. Nosocomial, yeah. So treatment. Hospital-acquired pneumonia we will talk about later, I suppose. So treatment for pneumonia in elderly typically involves antibiotics for bacterial infections and supportive care for symptom relief. Elderly persons may also benefit from vaccinations against bacteria that commonly cause pneumonia, such as Streptococcus pneumonia and Haemophilus influenzae type B. It's important for elderly persons with suspected pneumonia to receive prompt medical evaluation and treatment, as early intervention can help prevent complications and prompt recovery. Additionally, strategies to prevent pneumonia, such as vaccination and infection control measures, can help reduce the incidence of pneumonia in this vulnerable population. What else? Pneumonia complication, differential diagnosis, treatment, prevention. So in one question. Complications of pneumonia. Respiratory failure, of course. Pneumonia can cause the lungs to fall, which can be life-threatening. Respiration failure. Pleural effusion, fluid buildup in the space between the lungs and the chest wall. Empyema, so a collection of pus in the space between the lungs and the chest wall. Sepsis, a potentially life-threatening complication of an infection. Lung abscess, pus-filled cavity in the lungs. And ARDS, ARDS, ARDS is acute respiratory distress syndrome, a severe, very severe lung condition that can caused by pneumonia. Differential diagnosis of pneumonia: bronchitis, asthma, pulmonary embolism, heart failure, tuberculosis, lung cancer. Treatment of pneumonia: antibiotics for bacterial pneumonia, of course, not for viral. Actually, concerning antiviral medications that exist for viral pneumonia, but between us, zero confidence. But antiviral medications exist, of course. So you can answer like in this manner that antiviral medications for viral pneumonia. Bronchodilators for wheezing and shortness of breath. Oxygen therapy for patients with low oxygen levels, but be careful with that, very, very careful. Supportive care, rest, hydration, and symptom relief. No, prevention. Prevention is a vaccination, of course. Vaccines are available for Streptococcus pneumonia, Haemophilus influenza, type B, and influenza. Hand hygiene, washing hands frequently can prevent the spread of germs. Avoid smoking and exposure to second-hand smoke, of course. Practicing infection control measures in healthcare settings. Managing chronic health conditions that increase the risk of pneumonia. So, of course, we understand. I talked more than 20 minutes. You don't have so much time to talk about this. So, beginning, it's actually largely sufficient, but it depends, of course, of situation. So you will be 150 students, I suppose, and in one question answer like this, it's absolutely impossible. But question, and here is answer. So my good advice to you, my friends, re-listening these lectures. Don't be lazy, please. Don't be lazy. It's not only for exams. You make your study. It's for future your medical life. In several days, several weeks, we will be colleagues. Be careful with your specialty. Yes, of course. This is a sign of your noblesse, this white coat, my friends. Okay, so that's all. Also, with all honor, That's okay. See you in another lecture. So actually, don't forget to subscribe and follow these channels. This channel, the Dr. Y channel. See you in another lectures. God bless you. Bye bye.